Welcome to my podcast, Why Didn't Anyone Tell Me This? With my guests, we are discussing health issues with an emphasis on reproductive health, answering questions you may have about your health, and debunking some of the many myths around our health. And it's an absolute pleasure today to be talking to Dr. Jen Gunter. And we're going to be talking about her books from the Vagina Bible to the Menopause Manifesto. Now, Jen works as an obs-and-gynae and a pain medicine physician. Her approach is based on evidence-based medicine with a focus on empathy and the patient experience. She writes a lot about sex, science, and social media. She's been called Twitter's resident gynecologist, the internet's obs-and-gynae, and one of the fiercest advocates for women's health. Jen has a podcast, a TED podcast called The Body Stuff, and has written 3 books, which we'll talk about today: The Premi Primer, The Vagina Bible, and The Menopause Manifesto. Jen and I both want to educate people, debunk myths, and discuss taboo subjects. So I'm sure we're going to have a really great conversation today. Hi there, Jen.
Hello. Thanks for having me.
It's a real pleasure. So before we go on to talk about your books and podcasts, you do a lot on social media. People say I do a lot, but you do a lot. And you say you want to create a better medical internet, which I totally agree with. But there are not so many clinicians and scientists out there who dedicate their time to social media. And I'm always trying to encourage my colleagues to do so. So what has been your motivation to do this? And what's been the highs and lows of social media for you?
Yeah, well, I think my motivation is the fact that I see people harmed by what they've read online, and the difficulty in undoing disinformation, right? So somebody comes in the office and you offer a therapy which is standard of care, and there's just this barrier to it. And what you realize is this barrier is there because they've read so many things that are incorrect, or been exposed to videos that are incorrect about that subject, or they have a completely different sort of understanding of the disease process because of this disinformation. And then I contrast that experience with someone who's come in who maybe got their information from the CDC or from a site that's pretty vetted, and how much faster we can move along with care. And I feel badly for people who have been led astray by disinformation. A lot of this is not intentional on the part of the person who was creating that bad content, but some of it is doctors trying to get business for practices, or sell products, or have political agendas. And so this idea that even just that we have so many health inequalities to begin with, especially in the United States. But this is also another health inequality, the inability to get access to quality information. And when I had my own experience with prematurity, and my sick kids were so ill and had so many medical problems, this was kind of the birth of the medical internet around that time. And I found myself going down rabbit holes of disinformation. And it made me think that if that could happen to me, who I've always been the person who's been sitting in the back of the room at grand rounds with my hand up going, that's not what the study said, the very annoying person. And so I thought, wow, if that can happen to me, wow, every single person is at risk of this happening to them. And so I just sort of thought, after my kids were older and not so critically ill, what could I do to fix that problem? Because I saw how that problem affected me and affected other parents sitting in the waiting room. And so it really helped me see it in a different perspective. And so that was my motivation.
And you're right. It has got much worse with the internet, and it was there before. Myths were there before, but now they're so easily perpetuated into society. And I do get a bit frustrated that we've got to spend so much of our energy debunking myths, when I'm sure we'd rather spend that energy educating and not trying to undo. As you say, to undo something is a lot more time and energy than not. But let's we'll come back to that for sure. Let's talk about your career. and what led you to become one of the most outspoken doctors in the world, which I love.
I mean, I think I'm just outspoken. I mean, I'm just me. Obviously in the office, I have I'm very respectful of people, and I'm very, my whole thing is really informed consent. It's your body and it's your choice. But it's not informed consent if you've been given bad information. That's not informed consent, right? If I tell someone that their surgery has a 0% chance of having a complication, they haven't made an informed decision to have that surgery, and that's not fair. So, I think that that's really the driving force for me, is that there's people make all kinds of decisions in their lives that I would never personally make. But if they've got the information and they decide that's right for them, that's fine. Absolutely. Informed consent. And so I think one of the big issues that we've been seeing that didn't exist when I was in training, in the 80s and the early 90s, is this really explosion of medical conspiracy theory thinking, right? So yeah, we had disinformation, in the States and Canada, which I train in Canada, we used to have this magazine called Reader's Digest. And at the back there would be like, a page about putting an onion in your sock, to treat warts or whatever. And so there are those kinds of sort of folksy, I would say, myths that were more pervasive, but they didn't metastasize in the way that happens now, right? So, you get 100 influencers on TikTok talking about the same thing, reinforcing the myth over and over and over again. And we know that there's this illusory truth effect. The more you hear a myth, the more likely you are to believe it. And so in 1985, if you just read it in Reader's Digest, you probably weren't going to encounter it, again. And so now you read it online and then you encounter it 100 times in the next 48 hours. And it's a totally different situation.
And you've had this amazing career in obstetrics and gynecology. And what was your motivation to want to become a doctor?
Oh, well, I had an interaction with the healthcare system when I was 11. I had a skateboarding accident and I ruptured my spleen. I laugh about it now because there was a lot about it that was funny in a very tragic comic way. But I ruptured my spleen, and I found the whole hospital experience incredibly fascinating. I was very precocious. I'm sure that's unsurprising to anybody, but I was 11, but I was probably already 5'8". I'm very tall, so I looked older. And the hospital staff treated me like I was an adult, which is probably bad for a lot of 11-year-olds, but for me, it was right. That was the right way to treat me. And so I had to have this angiogram because this was before ultrasounds existed and before CT scans, right? That was it. And so I had to have this emergent angiogram to check my spleen. And they wanted to sedate me. And I said, no, I want to stay awake. I want to see it. I'll behave. I'll trust me. I'll behave. And I did. And I got to watch the whole angiogram. I just like had the local. And of course, they were all shocked this 11-year-old did this. But I was so fascinated. And the radiologist showed me everything on the screen with the spleen. And I just thought, well, this is super cool. And then, everything went, I didn't have to have my spleen out, which I was lucky about that. But they found out from the angiogram that I had kidney disease. So then I had to have all this workup. So my left kidney wasn't functioning correctly. So I had to have all this workup for my left kidney, go back to the hospital for multiple tests and other things, and which culminated in me having my kidney removed when I was 12. So then I was in the hospital for a week for that. And that's the old time where they cut you in half all the way around. Like I've got this scar that looks like a shark bite. And so, now it would be laparoscopic, or now it wouldn't even happen. Now someone would have an ultrasound during pregnancy that would have showed the obstruction and it would have been stented at birth and they would never have lost their kidney. So that's the miracle of modern medicine. So, but yeah, so I just was so fascinated. And the same thing when I was in the hospital, the staff, it was a children's hospital, but they spoke with me like an adult. I mean, when I was 11, I used to have to sub at my parents' bridge games. So if my parents played a lot of duplicate bridge, and if they were short someone, I had to play. So, I knew how to chit chat with the adults. And so, yeah, so I just got really interested in it. And I thought, well, this is super cool. I want to do this. So that's how I got interested in medicine.
Wow, that's a great story. So you went in thinking you'd lose a spleen, but you lost a kidney.
Yeah, basically, yeah. And the something that was very powerful for me was the first appointment we had with a pediatric nephrologist. So my parents are actually from England, and my mom had to, that back in the day of the 11 plus or whatever. So she left school whenever it ended because she didn't do well on that exam, like I guess age 13 or something around then, and went to work. And so she didn't have a really good understanding of anything that was scientific. Everything that was sciencey related, like, made her kind of panic. And so we're sitting in the pediatric nephrologist's office, and he's trying to explain what's wrong with my kidney. And she's sitting next to him, and she just like doesn't get it. And he said to me, "Hey, it's your body. You come sit here." And so we switched seats, and he explained everything to me. And I was like, "Yep, I understand. I no problem, no problem." And, and so then I tried to explain to my mom, and I was like, "Don't worry about it. It's like, makes sense. Don't worry." And then years later, when I was in medical school, we had a lecture about the kidney and about, they came across, what I had. And it was no different than what I'd heard in the office when I was 11. And that was a really powerful moment for me, that you could take something that a medical student needed to know, and you could make it in such a way that an 11-year-old or 12-year-old could understand it. And that to me felt like, medicine, so much of what we do is not difficult. It's just complex. And you just need someone to explain it to you. Now there's some stuff like how, like, acid base balance. So like I can never remember that. But that's okay. I'm not a nephrologist. But that's kind of been like my governing drive, that so much of what we tell people is actually not difficult. It's just they don't have the backstory to know it. So how can we pluck out the right things so they can be at that position, so they can be like I was sitting in the office and be able to be informed about what was happening with my body? Because once I wasn't scared about any of it, because it had all been explained to me.
Yeah, I totally agree. I always say it's not rocket science. If you're a good teacher, you can explain how the body works to the public, as happened to you, and that's a really great skill of a good teacher. And I think the public now are very thirsty for this. They do want to know. So we're in a good place to do this. So your first book is called the Premi Primer. Can you please tell us? I know it's a sad story, but I know you have related this before. I'd love to hear why you wrote that book.
Sure. So, the old adage in medicine is, you get to have the most complicated thing of your specialty, right? So, I was pregnant with triplets, of course, and had a very complicated pregnancy where I ruptured my membranes at 22 and a half weeks, and then delivered my first son, who we elected not to resuscitate. And then I managed to stay pregnant, which is not very common. And so then I had a cerclage, a stitch in my cervix, and then I stayed in the hospital for another 3.5 weeks. And I got to 25 weeks on the day I turned 26 weeks. On the day I turned 26 weeks, I got really sick, and it was clear I had an infection. So I had to be delivered. And so my boys were born at 26 weeks, and they were 783 grams and 843 grams. And obviously had a very, they were in the NICU for about 3 months. And then on top of that, Oliver had a complex cardiac defect. So he had critical pulmonary valve stenosis and a massive ASD, and so was having trouble oxygenating. And so he needed to have his valve fixed, but he was too small for the equipment. So that's, one of those conundrums. So he had to get to be 1,500 grams for them to do it. And they actually ballooned his valve at 1,500 grams, believe it or not. It's stressful for everybody. I think even most stressful for the interventional cardiologist, pediatric cardiologist, who was incredibly skilled, a god, an absolute god as far as I'm concerned. But I think it stressed him out as well. And so yeah, and then my son Victor was diagnosed with cerebral palsy and had a lot of issues related to that. And so, I spent a lot of time working with them with, I mean, think in the first 3 months after they came home, we had something like 67 appointments. And I mean, maybe it was probably more than that. It might be the first month. It was absolutely ridiculous. It was a full-time job. And they were both on oxygen for a year because they had bronchopulmonary dysplasia. And so I just thought, if it's difficult for me and I'm a doctor, how does everybody else manage this? And so that was why I decided I wanted to write a book. I wanted to try to help other people because I found myself, you get to know all the other families who were sort of in the NICU at the same time because you're all at the retinopathy prematurity appointments and you're all at the pulmonologist and you're all sort of see each other at all these different specialty appointments over the sort of the next year or so, because nobody really tells you, you think when you get through the NICU that you're just going to power through that. It's going to be that, but it's not. That's just the start. And so I found myself sitting in the waiting room, having people saying, well, I just don't understand what my doctor said. And I'm like, okay, but I think they mean this. So ask this question. And so I just found myself kind of basically doing medical translation, in a way in the waiting rooms. And so I just thought, people need like a textbook, but for them. And so that's kind of when this whole idea about basically writing medical textbooks, but in a way that, that's relatable and something you can understand for the public kind of came to me, that people need guidebooks. And so that's why I wrote the Preemie Primer.
Thank you for sharing that. And that turning around a negative situation into something really positive where you've helped other people, it is just amazing. My book, I did start writing my fertility book before I had fertility treatment, but then I went through 7 years of fertility treatment to get my kids, and then felt that it was really, really important to be able to help people understand what they would need to go through if they were in that situation as well. So the Vagina Bible, I've got a copy here.
Uh,
um, really, it is unbelievable. You start, as I started my book, by explaining anatomy, and it's still so amazing that we don't we don't know enough about women's anatomy, and it's 2023, and I get very frustrated about people not using the right words correctly. And sometimes I think maybe we should just give up and call it all a vagina. Um, but I'm holding out for the vulva. I'm really holding out. And the clitoris, wow. It's such an amazing story that we really are only just starting to understand that this, what we all said was a little bulb, is now not, it's a huge, wonderful, beautiful creation. So
yeah.
how do you think about this whole issue around female anatomy? And even, I think I saw someone say that originally they wouldn't be able to promote your book because it was called vagina, and it's considered as a dirty word, a offensive word, which is ridiculous.
Yeah. When the book first came out, both Twitter and Facebook wouldn't take paid ads for it, which is ridiculous. I mean, the whole idea that somehow, now I understand that, when you put in requests, that there might be an automatic flag of very specific words because that's how computerized systems work. But then what you should have then is a human looking at your rejected ones to make sure that you haven't kicked something out, because there's a lot of doctors on social media, right? So it's not as if there were no doctors on Twitter and Facebook, I could maybe understand that would catch their sort of, porn filter. Although those aren't words typically used, in pornography, but whatever, that aside, you'd think that they would have someone go, oh, the author is Dr. Gunter. Okay. So yeah, it was really fascinating. And my publisher then resubmitted the ads with all different wordings, and all the ones that didn't have vagina in got accepted. So yeah, I mean, it's ridiculous. And it's so, like, their body parts. It's so fascinating to me. And obviously, as somebody in gynecology who says these words every single day, to me, it's like saying vagina or vulva is like saying eyebrow or, elbow. It's the same. And the thing is obviously if you don't say words, then the implication is it's shameful. And that affects how people talk about their body parts. I mean, I actually, my big impetus for writing the Vagina Bible was the number of people who I've seen in my career who've been mistreated because they said they had a vaginal itch. And so their doctor assumed it was in their vagina. And then they come and referred to me because I do tertiary care, vulvar and vaginal conditions. And the first question I ask them is, okay, is it on the outside where your clothes touch the skin or is it on the inside? It's the first question I ask. And 50% of people had an external problem. They didn't have a vaginal problem at all. Yet some of them had years and years of vaginal products and this and that. And one visit and they're fixed. And so this whole idea that just informing people about their body was an act of empowerment, really became vital for me. That people need to be able to. If you can't describe what part isn't working, how can you get it fixed? I mean, imagine if the repair guy is coming to my house and my roof is leaking, but I can't tell him it's my roof, and all I can say is, well, there's water in my house.
Yeah.
Okay, so like where? From the sink, from the toilet, from the kitchen, from the bathroom, from the roof, from the floor. There's water in my house, right? So imagine if we didn't have words to describe something like that. Well, it's the same for the body, but we shouldn't be in that situation.
And it's true. Women are not, they don't understand what's normal and what's not normal. So she said itching, odor, what their vulva looks like, all this surgery. So reading your book, I was crossing my legs at the the chapter with all the genital procedures, and it's just unbelievable. And I wanted to pick up about pubic hair. So I'm with you. I'm a big fan of pubic hair. I have pubic hair, everyone. I've said it before. I work with Professor Sarah Crichton, and she has a lot of women come to her clinic, ask for labia reduction. And she's always been convinced it's because they're getting rid of pubic hair. They've said things like, but people at the gym can see my big labia. What are they doing? They're doing a hand. I don't know what they're doing in the gym. And she feels that a lot of women feel they've got irritation in that area. And she thinks a lot of it's because they haven't got pubic hair. Removing this pubic hair is just, it should be there. So how do you tell us more about pubic hair?
Yeah, well, I mean, the analogy I make to people is, you have your eyebrows for a reason, right? So it stops the sweat from dripping down your forehead into your eyes. And over the years, we have different, beauty ideals related to eyebrows, and shapes change, and because that's what people are like. And now that's the same for the, pubic hair, except, the origin of that is really, the of sort of having no pubic hair being the standard, kind of comes out of, these blue laws where, nudity was showing pubic hair, right? So the more you could show without pubic hair, the more in a strip show you could show, right? So now people get to do again with their body whatever they want. But the number of people that I see who have chronic irritation, that's related to removing pubic hair because it's traumatizing to the skin surface, right? So if you wax, if you shave, if you thread, you've changed the surface of the skin. You've changed the acid mantle of the skin. And it's so fascinating to me that everybody wants a natural product, but then you say, well, but this is actually, you have pubic hair for a reason. It traps odor, it traps moisture to keep the skin hydrated, and it's a physical barrier. And if you want to use it, that you remove it, that's okay, that's your choice, but you may also then have to accept that you might have some chronic irritation from that. So for example, you might have to moisturize daily, and you might not have to do that in your 20s, but by the time you get to be 40 and your skin starts to dry out, that might become a different issue for you. And then of course there's injuries related to removal and ingrown hairs, because that's how hairs get ingrown, is that when they're, generally when they're removed, when they start growing back up, they get trapped and then they curl back under. And skin trauma also is related to that as well. So again, it's about being informed, and you can use a trimmer if you want to keep it short. But yeah, I think that people have no idea, or a very limited idea, about the wide variety of how labia look. Think about our faces. No two faces are alike. People have big eyebrows, they have small eyebrows, they have turned up noses, they have, they have noses that aren't turned up, they have big lips, they have small lips, I have a tiny top lip, they have oval faces, they have square, we are so okay with people having this whole spectrum of how their faces look. And then when it comes to the vulva, we have a very one specific ideal. And it's always amazing to me that the ideal is smaller, because labia are part of your sexual response organs, right? So they have specialized nerve endings and they get engorged. And so trimming the labia is equivalent to trimming the penis. And for this whole idea about people can see me in the gym, well, why is that okay for men to have a bulge? Why is it okay for like Mick Jagger to go on stage, all these guys to wear skin tight jeans, and you can see all their junk through it? Why is that sexy? But it's not sexy for a woman, right? And it doesn't make any sense to me at all. And certainly, in the 70s, that was like a desired look. We used to, lie down with jeans so tight that you'd have to use pliers to pull them up. And you could see the shape of everything. And that was kind of the point. I think now, looking back, at the time, I like, when I was 17, I didn't get it. But, so it's really, I think, very a regressive idea, that you're want to tell people that they should have smaller labia. And so obviously it's people's bodies, and if that's what they want and they're informed about it, I mean, that's cosmetic surgery. But the majority of people who think it's causing symptoms, there's usually another cause.
Are they not worried about reducing their orgasms? That's an area that's so important for an orgasm. And I always feel it's like consenting female genital mutilation. Well, it is.
Well, in the United States, under the age of 18, it is considered female genital mutilation. And so, it's, if I saw somebody who had it done when they were 16 or 17, I would report that surgeon to the police. I would call. So, I think that a lot of it, certainly where I live, came from mothers like bringing their daughters in. And I'm like, stop looking at it. What is wrong with you? Like, leave her alone. So you're going to give her a body image issue. So I think again, it's related to all these ideas that are presented online about what's considered normal. There's like sort of, tabloid type papers down here that, that kind of promote it, and they interview doctors who do it. And, I mean, it's a huge moneymaker. And, I think that you have to be very careful about cosmetics that are all about reducing the size of sexual organs for women. And again, I always just make that analogy. It's the same thing. Could you imagine a world where we would say, we need to trim the size of a penis so it looks better in tight pants? There's no world, those sentence would never exist. Could you imagine if I published a journal article about that? People would be like, what are you talking about? And so whenever something comes out that I think that's just patriarchy, I translate it into what I call men. So I say penis instead of vulva, and it sounds awful when you say it that other way. So I just think it's important for us to think about what the messaging actually means behind it. And we don't have data about how this affects sexual function down the road. And the thing that concerns me is, with menopause, we often lose volume in the labia minora, and we get a little bit of loss of volume. And so what is going to happen? We don't know what's going to happen to people who have these labial reductions in their 20s. We don't know what symptoms they may be having in their 50s, right? So there's some potential concern there.
I've never thought about that. I know there's been concern we've discussed in our department about delivering your baby. There can be complications with the scar tissue. But yeah, the menopause is really important. Can I go back? You said something earlier about, do people really have their pubic hair threaded?
Yeah, I mean, I think so. I don't know. Somebody brought it up once, and then sugaring and, all that kind of
Wow.
stuff. So, and it's, again, people get to modify their bodies how they want. And I have patients who choose to do that and accept that they have to use chronic steroids, twice a week to maintain and that's what they want. And, there's also people though who wear shoes that are uncomfortable, but they like how they look. And it's a choice, and I'm okay with that. I think it's just the obvious trade-off with the shoes is what's uncomfortable or not. But yeah, I mean, there's people who will do that. I mean, and certainly, I wore pants that were very uncomfortable when I was younger because I thought that was the trend. But you can stop doing that, right? So it's reversible.
I live in Birkenstocks. um, Staying on the vagina. So, as you explained, it is a self-cleaning oven. And then we've got this big industry now, which I know upsets both of us. These lotions, potions. Well, we've talked about libido reduction, but other, steaming, all these other things, not helped by our dear friend Gwyneth and Goop. I'm so on your page about that. I couldn't believe it. On one of her documentaries, she seemed shocked actually that the vulva was a vulva. I,
Yeah.
I don't know whether I've heard you mention it as well. I don't know whether she really not know it was called a vulva. Unbelievable. But what would you say to women? I know what you'll say, but I'd love you to say what you would say to women who are thinking of using a jade egg or steaming or any of this other, what I would call mumbo jumbo, for
Yeah.
treatment.
So, I there's sort of two issues here. So a lot of that is remnants from medicine from before we had germ theory, right? Where people didn't know. So they put astringents in the vagina because women were considered too wet, not like because they had vaginal discharge, but everything in their body was too wet. That was when you go back to the sort of the balancing humors, sort of like early 1800s and earlier. So a lot of these vaginal therapies that, have been around for a long time are there for reasons that we know are completely false and actually are harmful today. So we have this long history of putting drying astringent things into the vagina. We also have this long history of a dry vagina being a good vagina, right? Because if sex is painful and not pleasurable, then you're a virgin and you're desired, right? If you happen to be sexually excited or, then obviously you've had sex before and you're a ruined person. So you have all these competing, so this back history of astringents because that was the medical therapy. This idea that a dry, tight vagina is socially desirable is part of our history, a long part of our history as well. And then you have into that mix as well illegal abortions and a lot of these vaginal products, in the late 1800s, early 1900s, were sort of offered as euphemisms for abortifacients and stuff like that. So you have all of that crossover, and then you have this kind of concept of any smell from a woman is obviously abnormal because clearly scrotum smells like flowers, I guess. And so that you have all of these interests that have now been sort of, they've given us a historical idea that maybe these products are valid, right? Because my mother would have heard it, your mother would have heard it, her mother would have heard it, right? For different reasons. And then we now have it commercialized into sprays that suggest that you should smell like a pina colada. And so it's just they're capitalizing, all these products are capitalizing on this history, and they're all harmful, every single one of them. It's every single study shows that any attempts to clean the vagina inside, including with water, disturbs the ecosystem. So it's hard to get that message across, because if you walk into an American drugstore and you knew nothing, say you came from another planet and you're like, I'm going to learn about people from a drugstore, and you walk in and you see all the shelves often labeled feminine hygiene, right? And not even menstrual products, but feminine hygiene. So you see pads and tampons and incontinence things because they're all for women. And then you see all these sprays and douches and stuff. and there's no aisle for men. You would think that women are gross and disgusting and there's something wrong with their bodies. Of course you would think that. Why wouldn't you? There's nothing in that drugstore to say otherwise. Why they don't sell special wipes for men? I'm like, what? Do you think women don't know how to wipe themselves after going to the bathroom? Like what is that? They're not babies. And a lot of this is the babyfication, right, of women, the infantilizing of women, that baby wipes have somehow become standard for wiping yourself. And I'm like, um, I can't even understand as a gynecologist who specializes in the vulva why that would be needed unless you have incontinence. And if you have incontinence and you're out of the house, I can understand how those wipes would be helpful for you, which is how they're used for babies because babies are incontinent, right? So it sort of becomes this messages are everywhere. And the word vagina is, as Gwyneth Paltrow said, like a cultural firestorm. You put it in a headline and people are going to click. So it's a very complicated social problem, and it's definitely not getting any better, which I find really fascinating given our obsession with the word natural.
It just amazed me, even in the broader health, not just in women's health, that we have so many products now that are harming us. I just am flabbergasted that we have, even now things like the low fat yogurts, people have said they're not healthy and they're bad for us. They've got too much sugar, but they're everywhere. You go in those supermarket shelves, it's full of things that are bad for us. Sugar. Oh my God, you can't go in any. I was thinking, yes, I was in a petrol station, a gas station, and I thought you can't buy any healthy snack in here. You can just
Yeah.
buy something that's really toxic, and it's the same with women's health. And you mentioned menstrual products, and this is obviously a really big one. So when we were growing up, we had tampons and sanitary towels, but now they've got period pants and menstrual cups. So how do you feel about some of these new products we've got on the menstrual products arena?
Yeah, I think most of them are amazing. I think choices are great. And some people love menstrual cups, some people hate them. Some people love tampons, some people hate them. Some people love menstrual discs, which are, sit higher up than a cup. Some people hate them. Some people like pads. People hate them. Period underwear, a little bit expensive, and maybe not always an option because you've got to have several pairs, but fantastic backup. I can't imagine, for example, a better option for a young person who's just started their period and doesn't really know maybe when it's going to come, wanting to wear underwear like that so you have protection. I mean, oh my gosh, especially considering how irregular periods are at the beginning. Or someone who has a heavy period and they like to wear a tampon, but sometimes they have a bit of leakage and they don't want to wear, a panty liner. So many options. I'm absolutely on board for that. I think that one thing that I have seen is kind of this overemphasis on menstrual cups, and I appreciate that from a environmental standpoint that they are better. However, um, it's fascinating to me that there's this emphasis on menstrual cups and not on reusable diapers, right? Because diapers are a massive, massive landfill issue as well. And it's always, to me, the burden seems to always fall on women. And it's so difficult for so many people to manage their menstruation in lots of different ways. I think that there's so many other areas where we could be more mindful of the environment and let people choose what works best for them, because a lot of people are just trying to manage through the day, and some people find cups uncomfortable, they really do, or they just don't like them. And I think that we have to be really careful, and we need to make sure that everybody feels whatever choice they want to use is a fine choice for them. I also feel we need to make sure that every choice is affordable. We wouldn't want somebody not being able to buy a cup if it's too expensive for them, or buy menstrual underwear or tampons. I mean, we know period poverty is such an issue. So I just think people need to have all the options, and maybe once everybody has all the options available to them at a price that's affordable or preferably free, then we can start having discussions about what people really prefer, and how maybe environmentally we can move forward. But I think right now because there's so much period poverty and so much inequity with products, the messaging really needs to be whatever works for you.
Yeah, and we're lucky now. There's some great schemes out there trying to tackle period poverty, and some of the things you mentioned, like the menstrual cups, give some more options in some of these developing countries. And I'm sure I'm not the only one who I leaked a few times in school and got blood all over my school skirt and was mortified. And having those other things like menstrual pants, I would definitely have worn those while I was at school as added protection.
Yeah, I
Let's
think they're genius.
Yeah.
I think the idea of the menstrual pants are genius. They also have them for incontinence too, by the way. They're not going to get a massive leak, but for somebody who's got some low grade leakage, they're a great product. And again, those should be available to everybody. And it's this idea. I see so much vulvar irritation from incontinence, from people not wearing the right products. And I see ulcerations on the skin, just skin breakdown, right? If you're bathed in urine constantly, that can cause a problem. So we also need to be thinking about the other end of the reproductive spectrum. It's not always at the other end. I mean, people have incontinence in their 20s and 30s. So I think that we need to make sure that we have equitable access to incontinence products as well, because I know it's probably understudied, but I would bet that we have incontinence product poverty as well.
That's a really, really good point. And so we've talked about some really positive products for women's health. I've been doing a lot of research around the femtech arena. So, what sort of new products are being developed? A lot of them digital products and apps, etc. And I have a bit of a concern, really, of where this is heading. I've heard a lot of pitches from mostly women who have got an idea about a product. Some of them have got funding for these products, and I don't get it. I'm like, I've asked them, for example, what they're thinking of measuring, what evidence they've got that they're actually measuring what they say they're measuring. It's going to do what they say it's going to do, and I normally hit a brick wall. They haven't validated anything, so I just worry that in the next 10 years that we're going to have the femtech arena flooded with all these what sound like great ideas, but in my view are not really empowering women, but they're exploiting women, and we're going to get an overload of these bright ideas. Have you come across some of these things?
Yeah, I haven't seen one thing from Femtech that made me think, wow, you're really solving a problem.
Wow.
I actually have a very, very negative view of it. I do not believe that you can help health if you have VC funding, venture capital funding. So venture capital funding is, these big investment groups that are going to give you, I mean, to them, $10 million is like chump change, like 4 or 5 million is nothing. But they're expecting to see 10 times their return on that. So, what kind of product in medicine gives 10 times its return in 5 or 6 years? Uh, you can't go through the kind of studies you need to show that it works. And I'm not saying that pharma doesn't make a ton of money from their products, but their products don't come out in 4 or 5 years, right? It's 20 years to bring a drug to pipeline, and along those 20 years, they might have started with 10 candidate drugs and had so many that fall out, right? So yeah, I'm very concerned about this. Like, if you have an idea, instead of getting venture capital funding to help women, what you need to do is get funding for a lab or a researcher to study your product so we can understand if it really does what you claim and can have the outcomes. Now, that's a slower trajectory, but if your goal is to help people, that's the trajectory. If your goal is to get rich, it's VC funding. Right? That's really all it is. And certainly, in the US, we see these virtual menopause clinics that have popped up, all with VC funding, I'm pretty sure. They all sell scammy products as part of it. One of them sells estrogen face cream because nobody gets rich writing prescriptions for estrogen. You're only going to make money selling products that have a markup that are useless, right? So other ones offer, we'll come in and we'll design supplements for you. So they're making their money in another way. The prescribing hormones is the hook to get you in the door, right? So people have to be very, very careful. There's these products out there for the pelvic floor that are like $400 that are supposed to replace Kegels and things like that. There's no quality studies with them. And so you're expecting the consumer to spend the $400, and maybe it's going to help and maybe it's going to not. But then I'm like, well, for $400, you could have probably had 3 visits with a pelvic floor physical therapist. And would you be in the same position? Now, I'm not saying that these devices maybe are useless. Maybe they're really great. We don't know. But it's very difficult for me to tell someone to spend $400 on a product when I have no good data. We're in a place and time where anecdote is unacceptable for a product like that. It's completely unacceptable. And that's what all these ideas lead to. Oh, well, in my experience, this happened to me. So I've designed a line of boric acid suppositories. We see that all the time. Yes. And then we see all this disinformation from that. And it's like, you have it all completely wrong. And boric acid doesn't balance the pH in the vagina. That's not how it works. It's actually a disinfectant. And think of it like bleach. And just like we do use bleach in some very specific areas of medicine, right? Bleach soaks on specific infections. That doesn't mean that you should be bathing in bleach every day, right? It's kind of a difference. And so we see these ideas that may have had some little medical validity in a small situation, and someone without the medical training then expanding that to everybody. We see people capitalizing on the microbiome, right? So we see all these areas, and I'm like, VC funding, sorry, I have yet to see something because if you really wanted to help people, you would want quality research. You would want to say, you know what? We published our data in the New England Journal of Medicine, bitch, take that. So, now our product is great. Like, there's no incentive to do that research because if your product doesn't come out top, then you've wasted all your money and your investors aren't going to get their 10 times return. So I'm
It's
very skeptical.
Yeah, I totally agree. It's so good to hear you say that. I always say, what's the mechanism? They can't normally answer that. Where have you published? How have you validated it? And they'd stop at the first the first fence. They can't say that. And we've got lots of tests. We've got fertility tests. Loads of people are marketing menopause tests, tests for everything. And I always say, if you've got a test where the result doesn't actually change anything, your advice or treatment wouldn't make any difference, why would you do it? Why would you then go and spend £300 on a test that's not going to change anything?
Yeah,
So it's I mean, and the list goes on and on and on, and all the apps and everything. It's I think we're getting ourselves in a real minefield. So I think the public need to sit and take note of some of this new technology that's coming out,
I mean,
and think about that.
I think some of the issue is, obviously medicine has done a bad job of listening to what people want and a
Mm.
bad job of communication. But these gaps are being exploited. And I think fertility tests is a great one. I mean, the ASRM is very clear. Doing AMH testing for fertility is not indicated. If you're seeing a fertility specialist and pursuing infertility, it has a value in that specific setting. But it does not have value if you're 24 or 34, just to see where you are on the infertility pipeline. And I've had people be angry at me because I wouldn't order the test, and I'm like, it's not going to tell you what you want. And so it would be unethical of me. Or people who go and get the test and then they stop their pill because they're like, oh my god, I'm infertile, or I'm going to not be able to get pregnant, and then they're pregnant a month later. And then now they have to deal with the fact they're pregnant where they didn't want to be. Or what if somebody got that result and thought, oh, okay, I've got plenty of time, and next year they're infertile, right? So there really is potential for harm here as well. And once you tell people that whole story, they're like, oh, But look, I get it. We all want there to be magic. I would have loved to have been able to take a test when I was 30 to say, hey, where am I on the my ovary, scale so I can plan. I would love that. But wanting it and it not being true, are two different things.
I totally, totally agree. It would be great, but it's not there. And if it's not there, then we shouldn't do something that's really substandard. And they're marketed as empowerment, and I really think they're exploitation.
Oh,
They're really
absolutely. It's exploitation. It's absolute exploitation. I mean, and so then what happens is professional societies are playing catch up, writing, guidelines to counteract that when, what, we should be doing more research. And, if you had $5 million of VC funding, instead of using it to design your mail in tests and your slick website, why didn't you do some research with that money? I mean, we all know the answer.
I've seen you say this as well. The trouble is that when we produce the guidelines from the societies, and the recommendations and etc., they're ignored, and everyone still does this. I've done a lot of work in the IVF add-ons area,
Oh,
historically, and so we've had a paper out this week about that, and we the European Society, we've got our guidelines. We've spent years writing guidelines, not recommending. There's only one that we recommend, but the rest we don't recommend. I worked with the HFEA in the UK, the government authority, about this. And the trouble is that the clinicians, the fertility clinics, they ignore them, and they still sell these things to their patients. So it is frustrating. We're in a frustrating area when we're spending our energy trying to overcome these myths, and they're just getting perpetuated. It's really
it's
frustrating.
it's so predatory. That's what it really is. I mean, in the States, we're seeing people, I think, getting platelet rich plasma injections into their ovaries. And I mean, there was a great study out years ago showing acupuncture didn't do anything for the endometrium. Yet people still offer it. And you're preying on people's hope. And I find that really cruel. As somebody who, spent a lot of time sitting by a ventilator in the intensive care unit, hoping. I think preying on hope is just cruel. Um, and if you have an infertility clinic, you're already making money hand over fist. Like, is it not enough? Is it not enough? And I think what happens is your competitor clinic offers it, so then you feel that you have to. And then what happens is medical care lowers, the standard of care lowers, because everybody needs to be doing it. And I just, the fact that people aren't offended, physicians aren't offended by this, really bothers me a lot. And I think that we need to have our professional organizations and the government, watching out more for consumers, because when you're trying to get pregnant, you're incredibly vulnerable. If you're sick, you're incredibly vulnerable. I mean, being unwell puts you in a very vulnerable position. And it's really sad that this sort of unfettered capitalism is, it's it's very ironic to me that the people doing the best here are in big pharma. It's very ironic,
Yeah.
right? Because they can't make false claims about their products. They can't do these things. And again, I'm not saying that big pharma is, is the people that they would do the same thing if they didn't have the regulations. That's kind of what I'm getting at, is that regulations work. Um, and I personally believe that every single product offered to a person should have to pass the same muster as a pharmaceutical. And if that happened, we'd see all the supplements stop. We'd see all these things stop. But, I'm not in charge.
I totally agree with you. All the supplements, etc. It's so unfair. But let's move on to the menopause manifesto. I loved it, really loved it, and agreed. I always, when I'm reading a book like this, think, am I going to disagree with anything? But I didn't. And let's
Oh,
start with
great.
yeah. Let's start with the wise woman hypothesis.
Yeah.
You've used words such as women should be flourishing, and the menopause is a marvel and not something we should be ashamed of. And you also say older women are amazing, and I totally agree. We are. I feel I keep saying this again and again. I feel the best I've ever felt in my life. Well, I think me and menstrual cycles and those fluctuating hormones did not go well together. I feel now I'm postmenopausal, very postmenopausal. I really feel wonderful. So we've got lots to talk about here. So let's start. People don't seem to want to hear any positive stories. I know we love watching TV that's depressing and violent, and it's almost like this, we don't want to read a book where it's a happy ending. People rarely talk about life post menopause and how wonderful it is. There's quite a few people doing this now, and it's great. We've got a movement coming. But why do you think people want to hear these negative menopause narratives and they don't want to hear the good things?
Oh, I think because we're all steeped in patriarchy, which is, ageism's a big part of that. And, I think, historically, this idea that you're no longer a breeder, so you don't have any value, right? And I think that, we're in a very ageist society, and the only people that are aging well are the ones who don't look like they're aging, right? And, we sell anti-aging products. And uh, so I think there's a big part of that. And I think that, we've seen an unfortunate resurgence of sort of 1960s medicine, where there are people basically, pushing this false narrative that all women died before the age of menopause, so menopause is a disease. And all I can say is, if you're saying that as a physician, then you're ignorant and you have literally read nothing on the subject. You're the opposite of an expert. It means that you don't understand the difference between average, between average life expectancy and it's so ludicrous. I'm like, oh, were there never grandmothers before? You never heard of a grandmother? Is that something totally foreign to you? People didn't have kids when they were 12 and be grandmothers when they were 20. We didn't start, historically, people didn't start reproducing until after the age of 16, and usually not, usually first birth was later than that. And so this whole idea, it's so bizarre to me. It's based in a book from the US in the 1960s called Feminine Forever. And that's where that whole idea was advanced. And it was actually a big pharma talking point, which I find is very interesting. Because if you have a new form of hormones to sell, they were now available in good oral formulations that were dose standardized. You need to make menopause a disease. And so, and the worst disease of all, one that makes women unattractive to men. So there's a lot of awful history with that. And I'm personally offended by any physician that toes that narrative.
Yeah, I quote that book as well, and what it says is really is unbelievable. But we have people in the UK, very prominent website that says very clearly that the menopause is a hormone deficiency disorder. Um,
Yeah.
I certainly don't believe it. I've had to debate it in our institute before. People couldn't believe that we were even debating it, but I can tell you that I slightly lost the votes. There were slightly more saying that it was a disorder, and that was in our Institute for Women's Health. Staff felt that it was a disorder.
So
So
they think puberty is a disorder too.
exactly.
Ah,
Maybe I got too passionate in my argument, but I and my opposer, instead of quoting research papers, was quoting newspapers, reports in, this newspaper had said this, and it was unbelievable. But people people do believe that, and as you say, this is big pharma. If we're saying it's a disorder, then surely you're saying that every woman should need, and in the UK we call it hormone replacement therapy, which I think is a really bad term. And
yeah.
you in the States you use menopause hormone therapy, and I think I'm on a bit of a crusade now. I think we should really try to stop calling it HRT and move that over. And also HRT in the UK is called HRT if someone's changing their gender, or
Mm.
confirming their gender. So we're getting very confused with different words. I know they're the same hormones involved, but it's really getting
Right.
confusing.
Yeah, and that's a more appropriate use of that term, right?
Yeah.
So HRT and HRT would be a fine use for someone with primary ovarian insufficiency because you are in fact then treating a condition. But it's not a replacement because you're not supposed to have high levels of estrogen when you're 60. I mean, you're just not. So yeah, it's really fascinating to me that people think this, and this whole idea of menopause being a disease. Well, it's one that makes women live longer than men because since the 1900s, women's life expectancy has been longer than men's. So how's that a disease? That sounds like maybe it's. I always say, well, isn't it a disease that men don't get menopause because they have a shorter life expectancy? I mean,
I yeah.
if you're
I'm going to
gonna, sorry, go
sorry.
ahead. I was going to say, if you're going to argue disingenuously, there's a lot of ways. I mean, I can get in the trenches and be as disingenuous as with the best of them. It's just ethics. So yeah, it's fascinating to me. Bias exists everywhere, obviously. So
I've
it's a
had so
problem because we're sending messages to people that they don't need, that are wrong.
I've had so many arguments on social media with women saying to me, but we're not producing estrogen and progesterone anymore, and we've got to put it back. And you know, it seems that they think every woman's the same, and we're not the same. And everyone's had different. We've got different genetics, we've got different nutrition, exercise, sleep. We'll come on to that in a minute, and we've got different lifestyles, and we've had different things go wrong with us along the way. So to think that this hormone replacement therapy or menopause replacement therapy or menopause hormone therapy is going to be the answer for everybody. And it seems as well, people are saying it's the answer for everything. So suicidal thoughts, preventing dementia, preventing heart disease. And I think this is a very, very dangerous narrative to suggest that if you're on hormone therapy, you're not going to get some of these chronic diseases. I think in 5 or 10 years, we're going to see, or 10, 20 years or more, we're going to see women on hormone therapy who thought they were never going to get these diseases because that's what their doctor told them. And then they have. And you know what? Along the way, they weren't looking after themselves. They weren't sleeping well, exercising, looking after their nutrition. So I think we could even possibly see a higher rate of some of these chronic conditions in those that are on hormone therapy.
Yeah, and I think one of the big problems that you have in the UK, and we have to a lesser extent in the States, is people prescribing over the licensed doses, right? And so all the data we have on safety is with the licensed doses. So we don't have any. So even if you're going to argue about dementia, which the studies do not show that we do not recommend estrogen to prevent dementia, but if you're going to argue that, all of your data is from people using the equivalent of 100 microgram patch or less. That's all the data is from that. All the data for the heart, all the data for everything. We do not know what these supraphysiologic doses could do long term. And that's a significant concern. I always remind people that 100 microgram patch is the equivalent of the average level of estrogen that you would have had throughout the menstrual cycle. Now, considering it's lower at the beginning and higher when you ovulate, it goes up and down. So this idea that you should be replaced, if you're going to use that term, with a higher dose doesn't make any sense at all. You're not treating a deficiency. If you're treating a deficiency, if you're really going to believe that narrative, you should be sticking with the standard levels, right? So using these levels that are birth control pill equivalent or higher, we have no idea how that's going to affect your clotting. We have no idea how that's going to affect the blood vessels in your brain for vascular dementia. We have no idea. So it's very concerning.
I don't know if the women have been told that they're being treated as guinea pigs, but I fear that they don't. And it's not a research study. It's the same as with some of the fertility treatments we mentioned earlier. I hear the same arguments with the menopause clinics. They say, "Oh, but in our clinic, the women are telling us this and that and the other." It's anecdotal evidence, and I always say the same thing: if you've got evidence, please publish it. And they can't publish it because it's not a
Yeah.
scientific study; it's anecdotal evidence, which means nothing. We can't function like that's
So
not evidence based medicine.
my answer to people like that is I'm quoting clinical trials and you're pivoting to anecdote. Don't insult me.
Perfect. I love that. And our latest craze in the UK now is testosterone. So everyone needs testosterone, apparently. What do you think about
Yeah.
that?
The data doesn't support it at all. In fact, it doesn't even support it, well with primary ovarian insufficiency, right? So there are studies that show that adding testosterone didn't make any difference in outcomes for people who actually, had a high, if you're going through primary ovarian insufficiency, you're losing your testosterone levels at a younger age. I think that we don't know what we don't know about testosterone. Because for example, we know that libido is completely unrelated to testosterone levels. And all of what we think about testosterone is based in these patriarchal notions that it's a good hormone, right? In the right dose for women. You got to walk the line. You have too much, then you're too masculine. But if you don't have enough, you're not feminine enough. It's sort of this whole like being a woman is walking on the edge of a knife. And so, if the data were there, we would support it. But I mean, I see tons of people on it for libido who it's not working at all and they're still taking it. The number one treatment for libido is medical mindfulness. The studies for that blast everything else out of the water. They're so amazing. And it doesn't get offered. And there's a whole, it's a whole different discussion. So, I think that people promote testosterone, my personal opinion, is because they can make more money from it, because you have to follow levels. You have to do that. And so then you have to order the tests, you can charge people for it, and you have to charge them for reading the tests and charge people for the visits to continually adjust the doses. So if this was something people just put them on and it was one and done, I don't think we'd see as much of it. That's my personal opinion.
I always think we need to start right from adolescence. For reproductive health, I always talk about our pillars of well-being, our sleep, nutrition, and exercise. And some people don't want to say the word exercise. I'm saying the word exercise. I'm not going to say movement. I'm saying exercise. We need to get sweaty. We need to increase our heart rate. So if we looked after this, if we taught young people the importance of this for their lifelong health and their lifelong reproductive health, some of the fertility issues will certainly be reduced. Preconception care or pre-pregnancy care, problems with pregnancy. And then when we hit the menopause, we would be in a much better place. So, how do you feel about getting this narrative out about the importance of nutrition, sleep, and exercise?
I mean, I think it's kind of the whole holistic medical care model. And I think that what's really problematic for women, especially, is when you're in your 40s, you're often in your early 50s, you're you're doing the bulk of the emotional labor in the house generally. I mean, obviously there's outliers, but in general, at your work, you're probably doing the bulk of the emotional labor. You are probably more likely the person who's doing the groceries. That you're probably more likely doing the stuff that keeps the house going. You have kids that are graduating high school, and you're all that stress with college, and so you have a lot of stress, and maybe you have elderly parents that you're also helping with. So I think when people are in their late 40s, early 50s, they're kind of in this nexus. Even if you don't have kids, you're suffering the weight of ageism, and still probably bearing the brunt of emotional labor where you work, right? So I think that people are in these very difficult situations, and they think that when they feel unwell, that the answer must be a pharmaceutical, that must be a hormone, that must be the problem. And I see a lot of people who are on adequate doses of hormones that are still fatigued or still having problems. And the number one question I ask is, so tell me how often you get outside for a walk. And the answer is almost never, because there's no time. They're so pressured. And I don't mean that in any like they're bad people kind of way, but we have so much data to show that just even going for a walk every day is amazing for your mood. It's going to help your sleep. It's going to help your longevity, like just a walk. And obviously, there are also people who live in areas where it's not safe to go for a walk. And so those are other issues. But this idea that the answer is with a patch and not with looking back at the whole sort of holistic situation, is problematic.
And you're right. I hear from so many women, I haven't got the time. And I say, you need to make that. I mean, listen, today I've done a workout. I've done a half an hour workout in and two batches between running kids to school. which is not ideal. Why couldn't I find 30 minutes continuous where I could have done the class in one go? But I think we just have to work with what we've got. But I really think we've got to get the most important for me health messages across is find the time to eat well, to exercise, and then that knock-on effect, a positive effect on your sleep
Mhm.
is it just happens. So listen,
Yeah.
we could talk about. I've got 100 more questions about the menopause, but we do agree on everything. So we could talk about it forever, but let's move on to your podcast, the body stuff with Jen Gunter. I've heard a few of them there, and they're so good. And as you
Oh,
say,
thank you.
oh no, it's great. You are here to bust the lies you're told and sold about your health, debunking some of the stickiest myths out there, while helping you to understand how your body really works. So we've brought that up a lot through our chat today. Um, what are the top three myths? If you just have to pick three generally in all the work you've done, what would be the top three that worry
I
you?
mean, that you need 8 glasses of water a day. That's a big one. That your vagina needs cleaning and that menopause is a disease. I think those are probably my top 3. And I think if we could, get rid of those 3, we'd be in a good situation.
Love it, love it.
And I hate to say this, but I am going to have to get off in a few minutes because I have a hard stop coming up. So
Okay, well, just a couple of quick questions. Have we
sure.
got time to talk about your online dating?
I can give you a very, very short spiel.
Yeah,
So yeah, so I got divorced in my late 40s, and I dated online for a while, met someone and dated them for 7 years, but they didn't turn out to be the right person. I should have left earlier. And actually, my kids had an intervention with me, and they're like, "Mom, you're just trying to make a bad situation work." And he's a nice person, but he's not your nice person. And we're going to go off to college in a couple of years, and you're going to be really lonely because you're going to be with him. So you need to break up. So I took their advice because they were right. And sometimes you just need to hear the words out loud. And I got back on online dating, and I had this, I was on for maybe about a year, and so many bad dates. To call the paramedics on one. I was like all kinds of stuff. Yeah. And anyway, so I was about ready to get off, and I saw this profile fly by at the bottom when they're like, "Oh, if you like this person, you might be interested in this." And I read the profile. And I thought, that person sounds like they're looking for me. And of course, you're like, no, they're not, because they're lying, because it's online dating. And he was exactly who he said he was. And I sent him an email. And a few days back, he emailed, and we've been together for 3.5 years. So, and we recently exchanged rings. And so, yeah, I'm with my forever person. So it's pretty cool. So he just, it took someone, and it was he was coming out of a 25-year marriage. He hadn't dated in 25 years, longer, because I guess he'd been with his wife for a few years before that. And he's in marketing, and so he wrote his pitch in a really good way. So that's how we ended up together.
I love it. And just I'll announce to everyone, you making me want to go back on online dating. So I'm going to give it a go this week. And Jen, have we got time to just ask one question? What makes you happy, and what's your happy place?
What makes me happy? What makes me happy is a really beautiful sunny day. Really does. Just the beautiful sun outside and feeling the sun on my face. I have to say that's like makes me very content, especially if I'm sitting on a beach. That it makes it even better. So that would be my happy place. And what makes me content? My kids are okay. They've had a rough go of it. They're doing really well now, and I think knowing that they're doing okay, that helps to take a stressor off my list.
Thank you so much. It's been really lovely. We had a big chat before, so that's why we ran out of time. So thank you so much for being on the podcast. And I'm hopefully looking forward to meeting you this summer.
Yeah, hopefully when you come to the area. So hopefully
Yeah.
we can hook up and have a cocktail or a coffee or whatever.
Cocktail sounds really good. Thanks very much for your time. Thanks, Jen.
All right.